Meeting to order. Commissioner Campbell had a phone call at 8:30, so he will be in momentarily, so we'll kick it off. We are looking on item number 1 would be a call to order, the approval of the agenda.
Move to approve the agenda.
A motion by Commissioner Gross to approve the agenda.
Second.
A second by Commissioner Ebinger. Further discussion. All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carries, thank you. Our next item will be our employee recognition. Okay, for 15 years of service, Elizabeth Buer. Elizabeth, you want to come up? Elizabeth, this plaque is presented to you in grateful recognition for 15 years of service to Clay County and its citizens. Thank you very much. Kathy, do you want to step up? Oh, Jamie.
Good morning. First of all, I want to congratulate and thank Liz for 15 years of service. Liz actually joined public health as a evidence-based home visiting nurse under the Nurse Family Partnership Program, and then in 2018 she became our coordinator. So she leads the nurses in that program. And just before COVID started, Liz was working on preparing a celebration of 20 years of the Nurse Family Partnership Program. And when that pause happened, then she took on the role of working with all of our child care providers and home daycares and supporting them in COVID, and then moved on to she's our planner. So she does all of the scheduling and training of our students and vaccinators for COVID. So thank you.
Steve, for all of these nurses, I think the 1 year of service may be equal to 15 years of service, so let that be noted for the record later. All right, our next award would go to David Overbo. Mr. Overbo, this plaque is presented to you in grateful recognition for 20 years of service to Clay County and its citizens. Thank you so very much. Steve?
Thank you, Dave. We're extremely fortunate here at Clay County to have someone with Dave's knowledge and expertise. I think I'm constantly amazed at his knowledge of our county system, whether it's in highway tracking or at this board when commissioners have questions about a particular issue within the county. He can tell you where that dip in the road is or the problem with the surface, sometimes even down to that mile marker. And so we're extremely fortunate to have someone dedicated. I think another message that stands out to me is his assistance. He shares that knowledge and expertise, and those assistants often find themselves into a new promotionary opportunity, whether that's at MnDOT or another county themselves. And so I think that says a lot about what Dave's willing to do as far as sharing that knowledge and wisdom. So we're about the same age, so I'm looking forward to the next 20 years together.
Our next recognition today is for Annette Montpleasure. All right, Annette, this plaque is presented to you in grateful recognition for 32 years of service to Clay County and its citizens. Annette has served us as an office, an administrative specialist, a probation officer, a communications office, and a 911 dispatcher. Congratulations, Annette.
Thank you.
Yeah.
Thanks so much.
Janelle?
Thank you, Annette, for so many years of service to this county and to our office. I know when you came to probation, you had years of service as dispatch, and I know that helped us enormously with just your knowledge of the language and running criminal history and pulling data. And I know that not only staff within your primary office, but other offices have reached out to utilize or access your knowledge and expertise in getting criminal history. I did reach out to several staff to ask if they had anything that they'd like to add, and consistently they talked about how approachable you are, how you always go above and beyond, you're willing to help and go the extra mile. And I can think of a situation where someone came lost in the building, wanted to find a different location, and instead of pointing them down the hall and down a floor and whatnot, you gave them a personal escort. And I think that that shows how willing you are to just constantly learn how things change. You're willing to seek additional training, attend additional training. You just really go above and beyond, and we're very appreciative of you supporting us and making us look good. Thank you.
I am back. All right, congratulations to all of you. Our next item is the citizens to be heard. Do we have anybody in the audience who wishes to be heard? I understand we do have one written. Eve?
We do, Mr. Chair, members of the commission, thank you. We did receive a request to have this read into the record today from Mark Rice, located a citizen here in Moorhead. His concern is that they're limited roads to bicycle from South Moorhead to the Convent Road or 60th Avenue South. Highway 75 is a shoulder in bad need of repair and poses a danger to all bicyclists in both directions. 3rd Street South is a safe alternative, but it's in need of some greater work to repair the deep ruts. Would it be possible to see what can be done to repair these ruts? And so the road is a Moorhead Township road. We do have a service agreement with Moorhead Township for spring and summer maintenance. The road was first graded back on March 24th, and it was actually done again this morning at about 6:30. And so the hope is that it will be in better condition. Just for a record, I think it's important in talking with Dave, this is considered a minimum maintenance road, and so the township doesn't even gravel the road, so it's straight dirt. So anytime that we have any type of precipitation, they can't do a whole lot out there as far as grading until it dries out. And so I know that the Moorhead Township has been working with the city of Moorhead over the last couple of years in hopes of securing a TAP grant that would provide some access for bicycles, not only on that road, but going to a bridge across by Blue Stem over the river. Unfortunately, at this point, they haven't been able to obtain that, but that is something that they hope to do in the future.
All right. Thank you. Any other citizens' comments? We'll move on then to the approval of bills and vouchers.
Move to approve the payment of bills and vouchers.
Second.
A motion by Commissioner Gross, second by Commissioner Kaylee. Any further discussion? Seeing none, all in favor signify by saying aye.
Aye.
Opposed, the same sign. Motion carried. Approval of minutes from April 29th.
Move for approval.
Second.
Motion by Commissioner Ebringer, second by Commissioner Kaylee. Any further discussion? Seeing none, all in favor signify by saying aye.
Aye.
Opposed, the same. Motion carried. We'll move into our 8:35 item, our COVID update. Kathy and Jamie are back. Good morning.
Good morning, Mr. Chair, Commissioners. You all received the handout for this week with our COVID updates. And as you see, the cases continue across the state of Minnesota and in Clay County. So there's no decline yet, obviously, in those cases. And we have an additional death in Clay County, so we're at 91. Unfortunately, lost another individual to COVID. And then there's a few additional deaths across the state of Minnesota from 7,079 to 7,163. So we're seeing some additional deaths. Active cases did decline since last week. So we were at 190 and we're at 167 this week. So, I mean, that's positive, but again, it fluctuates, obviously. We have hospitalizations and people in ICU. I talked with Minnesota Department of Health, and what they're seeing currently is the hospitals are managing okay, but we're seeing increase in cases for school-age children now. So, and unfortunately, some younger individuals are being hospitalized And those in ICU, I know there was, for example, a 40-year-old with no comorbidity, so they had no underlying health conditions, and obviously, that's not a very old age, and they were on a vent. So we're seeing some of the unfortunate cases where people aren't at the high-risk category and yet getting very ill from COVID. Our 14-day case rate went down a little bit, so that's also promising for Clay County. It was 64 last week, so now it's 51.43. So that's going down a bit as well. So you see the graph at the bottom is just the cases per week. So we just graph that out. And again, we're seeing a decline in that. The next page is our cases by zip code, and so Commissioner Mojo had asked about that last week, and then we just added a column for whether they increased from last week or not. So you can see that there's some increase in cases in Moorhead specifically, some in Dilworth, and a few in Sabin, but some of the other areas we did not see an increase in those cases. The active ages, cases by age, so we see that there's high numbers in the 10 to 14, and just as a reminder, we have no vaccine for those under 16 yet. The Pfizer is the one that we can use for 16 and older, so we don't have any vaccine for the younger groups. We still have high numbers in the 20 to 24, and the 30 to 34, and then actually the 35 to 39 as well. So anywhere from the school age to like the 40 is, again, what they're seeing across the nation and across Minnesota. And then the cumulative cases by age are at the lower graph. And again, the highest one is the 20 to 24 age range. The hospitalizations per week are listed in a graph. There was, I think, just 10 additional hospitalizations when we checked last week for our hospitals in Fargo. Again, a manageable amount, but the concern is, again, younger ages being hospitalized. And then across Minnesota, they were increasing, but they're staying stable as far as hospitalizations in ICU. We're not seeing, again, the large increases that we had previously. And then we go into the testing, the vault testing site. And so we got our last week, April 25th is our last week that of the testing activity. Not the last week for vault testing. They're going to continue. We haven't heard an end date of when they might ramp down, but we see a little bit less of the number of tests conducted in the week of April 25th, 893, but still a fair amount of testing being done. Positivity rate is 5.18. But the testing site still continues at that vault testing.
Kathy, are you hearing much about this, the availability of at-home test kits now? I think they're on the market.
I haven't heard that, but they are available free through the Minnesota Department of Health. So, but no, haven't heard that.
Do you have them, at Public Health?
Yes.
And
So,
those-
no, I'm
No,
sorry, you have to order them from the State Health Department.
Okay.
So you can, and that information is on the county website, and also the Minnesota Department of Health website, so you can have that delivered directly to you.
Okay. I do know that they're available in some retail places too.
Didn't-
So I think there's other testing going on locally
Sure.
too, besides these places, so.
Sure.
Kathy, I think Commissioner Mojo had some questions for you before we get into the vaccine.
Oh, absolutely.
Thank you, Commissioner Campbell. Just pivoting a little bit, Kathy, to another issue in your wheelhouse. There have been reports nationally and statewide about the increase in detox overdoses, usages. Fentanyl overdoses are up 27% in Minnesota alone. Can you talk a little bit about what you've seen trending with our own detox center and what you're hearing from the officers in the field.
Yes, we did receive the health alert from the Minnesota Department of Health about such a large increase in the opioid deaths in Minnesota. So from even 2019 to 2020, a 59% increase. That's pretty significant. And we are one of the detoxes across the state of Minnesota who serve all individuals. Some detoxes will serve alcohol only. Some do not want to take all of the multiple
They don't
drugs.
serve alcohol,
They don't serve alcohol.
Okay. Just wanted to
Yes, I'm
clarify
sorry.
the
Thanks for
record.
clarifying. Yes, that wouldn't be good, would it? They serve the clients who have alcohol, high levels of alcohol, but they will not serve clients with opioids or meth, some other drugs that are being seen. And we're seeing a lot as we go through this, the increase from alcohol to multiple drugs, and oftentimes it's multiple drugs. We're seeing an increase over the years of that. So the benefit we have in Clay County is we're serving all of those individuals. We're also serving pregnant women who are having chemical use issues with drugs and alcohol, and some other detoxes across the state would not serve pregnant women. So it's unfortunate because we need a location to serve all of these. So we're definitely seeing high numbers. We're also seeing the acuity level of these clients is pretty high. So when you have a detox we have a medical oversight, and then we have nurses on every shift and medications to help them through the detox process. And so it's really important when you think about where are these individuals going to go, and the number of increases that we're seeing nationwide and across Minnesota is pretty alarming. And so we are, it benefits our whole community. We met with our previous medical provider passed away, and so we have a new provider from Sanford who just last week came to our facility. He wanted to see view the facility for himself, and then talk about our programming. And he expressed the high need. He worked in some other states where there was no place for individuals that were overdosing or needing to detox. And so he really sees this as a huge benefit for our community. We have a detox in Fargo. They have a detox in Fargo, but it's not the same level of care. They do not have medical oversight. They don't have nurses. There's a need for those, but that's a lower level of acuity because of the demand with all of the effects of these drugs. It's really a high level. So he expressed he really likes the fact that we have a detox in our community that can serve the metro area and then others across the state of Minnesota. He did say how much it saves on ER visits. Otherwise, where are you going to bring people? To the emergency departments? And potentially they tie up a bed for a few hours as you're trying to determine where they can be placed. And so he really sees this as a benefit. Obviously, we have a small facility, and so we express the hope that we would be able to increase the bed capacity and maybe another location in order to serve a greater population in our community. The problem isn't going away, so we see this as he really expressed, and this is the first time he had been to our detox. Obviously, he took over from the previous medical director, so he was very impressed with what we're doing, the fact that we have a new license, withdrawal management license, and so we'll have more capability to generate some revenue from that.
Well, and thank you very much for answering that and giving, I think, our audience a broad understanding of the services provided. I think from this perspective, it's really important to see how COVID has affected our community as a whole. And that's not necessarily just with the data that we receive weekly. I think COVID has strained families and individuals in ways that none of us can really know. And it's heartbreaking to see these increases. I think, we've had discussions as a county board on how to help keep our community and county safe and healthy going forward as we move out of the pandemic. And I'm deeply concerned that we'll have some residual effects in this area in particular moving forward, so thank you.
Yeah, and Mr. Chair and Commissioner Mojo, we, not to be amiss, that although they're, it's chemical use that brings them into our detox, there's so much underlying mental health issues as well that go along with that. So we're really seeing the, comorbidity of that.
Thank you.
Well, Commissioner Mojo, thank you for bringing that up, and we have been having some dialogue on that, and we were able to do an awful lot with our CARES dollars that were received, and unfortunately, I don't think we were able to accomplish enough with the detox portion of it, although it still had, it makes it significantly harder for you to do your job in your confined space. So I think as we move forward, and I do want to point out that Commissioner Ebinger and I are serving on another task issue with Across the River, and I did raise the question to them about detox and maybe looking into the future of partnering on something, and there was some real excitement on the part of the Cass County Commission members that were at that meeting. So I think we'll be looking at that together to see if we can. I think when you look at some of our smaller counties, the Wilkin counties, Monoman counties, Norman counties, they don't have a facility, and I think for us to be able to tackle this from a regional approach might be a really good option for us. So that dialogue has just started. So just so you're aware of it, and I don't know if Commissioner Ebinger wants to add to that, but we'll be working on that.
Great.
Yes, just one more step, and it is really critical that we look at this regionally. But that's when we get our greatest successes, is when we approach it as part of the community, not just across the river, but east of us in some of those counties too. All of them have expressed a need for medical detox. I'm part of a group that's looking at some of the issues that have impacted on the homeless shelter here. Pastor Sue put together a group of us, including the chief of police. One of the issues that is foremost is some of the limited psychiatric beds won't take somebody who's intoxicated. And there's the other issue I see, which has been happening for years, and we have not addressed it, but there is the Oxycontin addiction has now led to fentanyl being manufactured offshore to look like Oxy, and it's being sold, and even if they're not intentionally disregarding the amount within each pill, it's a sloppy operation. Some of them are going to have 3 times the amount they planned on it, and some of them very little. And that's where the overdoses are coming from. And that's where the increase in addiction is coming from, on the opioids. And meth has been a problem in the Red River Valley for years. So this is something I think its time has come, and we need to do something about it. I think we can. And again, that's something we want to look to the future on here pretty quick. But thanks for your efforts on this.
And thank you.
All right. Amy, you want to talk about vaccines?
Okay, we'll talk a little bit about the vaccine data for Clay County and Minnesota. In Clay County, people with at least one vaccine dose were at 39.4%, and people who have completed the vaccine series is at 32.9%. And again, we have the age breakdown of the number of individuals vaccinated. So we didn't make a lot of progress in that 16, 17-year-olds, but there are slowly an increase in the number that we have. And then 18 to 49 is at 8,175. And then the 50 to 64, 4,896. And then the 65 plus is 6,123. So total of 19,475. And then people 50 and over with at least one dose, we've got 48% for the 50 to 64-year-olds and 74.7 for the 65 and over. And then we've got the Minnesota data. We've got larger copies so I can see them, so hopefully you can see them as well this week. And so the statewide number of people with one dose is at 58.6. People have completed the series, 45%, and then you've got the breakdown. I won't run through that, but for the 50 plus with at least one vaccine, we're at 63.1 for Minnesota for 50 to 64-year-olds, and 60 plus is 87.2% statewide. And then we have the breakdown by zip code again, and shows the percentage by zip code of individuals who have received the vaccine. Give you a minute to look at that. And then we'll go on to the Clay County Public Health vaccine that's been administered. The total doses administered for Clay County Public Health alone, we are at 13,750. And this past week, it was 391 doses, so things have slowed down significantly. We are seeing more of the second doses that we're administering than first doses. And then also the timing is perfect for that. So we are no longer able to use the students. The nursing students are finished. So I want to take a minute to thank NDSU, MSUM, and M-State for all of the hours and that the students and staff have put into vaccinating the community. And then we've got the data from Cass County that we've put in there as a comparison for Cass County and North Dakota at the bottom of that grid. And another thing that Kathy brought along with you, or for you, is just some myths. Our public information staff have been focusing their energy on hesitancy, vaccine hesitancy, and trying to encourage people that they continue to need to be vaccinated. And so she shared some myths and facts, and these are also posted on our website and have been shared with all the county employees. The public information staff talked yesterday that they received a lot of positive feedback from the staff when this was shared with them as well.
And let me just add, Mr. Chair, that initially this was sent out to all of the faith communities. So Commissioner Cayley had brought up some concerns about what's being discussed out there as far as facts and myths. So we did send this out to all of our churches in Clay County, as well as the chamber and other various organizations. And then, again, like Jamie said, on our website. So hoping to get, because it's interesting, we get kind of over and over. There's one in here about that the vaccine alters the DNA of an individual. We hear that a lot. Truly a myth. There's no way possible biologically it can affect your DNA. So there's just some interesting myths and then the facts in there as well. I know there's individuals that have shared it with family members who believe some of the myths. So it's really great information. And like Jamie said, getting lots of feedback from people that have received this about, making sure that we have the facts versus so many myths that are out there.
Commissioner Gross.
I got a question on Clay County. I mean, I look at our percentage of people who've taken it. Is that because, we're pretty low, I think. I look at 39% and 32% with one vaccine or with two. Is that because we don't have it available, or is that just people not doing it,
It is available, but we do believe that not all of the data is getting to Minnesota. So anyone who goes to a pharmacy on the North Dakota side, we don't get that data. So if you're a Clay County resident and you went to a pharmacy on the North Dakota side, we don't have that data. And then also anyone who went through the Veteran Service Office, or the data does not go into the Minnesota immunization system. So yes, we do believe.
I could visualize that could be a high number, okay. So,
Thank you.
Right now, it doesn't look that we're doing that good,
Yep.
And Mr. Chair and Commissioner Gross, the state, so they understand that there's quite the dilemma about those going over to the Fargo side, and there may even be a delay of some of the information even beyond the pharmacies and the Fargo VA. So they're pretty confident we're close to the Minnesota percentage. It's just we can't accurately reflect that because it's not accurate information that we're receiving.
Thank you.
Commissioner Ebinger.
If I could just add to that, I have personal knowledge of a couple of people. I helped one of them register who work in healthcare on that side of the river. And in order to get through the system, and this was early in the process, the address that they used was that of their employer. So I'm sure those immunizations are showing to be residents of Cass County, North Dakota, when they're actually residents of Clay County, Minnesota. And that would elevate, and they're doing a good job over there, but that would elevate their numbers a fair amount, and they wouldn't be reflected in our numbers. So there's probably a balance in there somewhere.
And Commissioner Ebinger and Mr. Chair, that's correct, because we know of people that use their work address, but they're actually residents, both in all the healthcare systems. So the numbers are certainly inflated on that side and don't reflect it on the Minnesota side or Clay County.
Does that conclude your?
Concludes
Might
our
wanna-
report.
You might want to stay here for a minute because we have, this is National Nurses Week and we have a proclamation we'd like to read. And I think we'll start with Steve and we're going to go around and read this proclamation on behalf of all of your hardworking nurses.
Whereas nurses are not only the cornerstone of patient care, but are also leaders in improving the quality of care and seeking ways to continue increasing access to care. And
whereas the depth and breadth of the nursing profession meet the different and emerging healthcare needs of the American population in a wide range of settings, and
Whereas a healthy nation relies on increasing delivery of primary and preventative health care, and
Whereas a renewed emphasis on primary and preventative health care require better utilization of our nation's nursing resources. Professional nursing has been demonstrated to be an indispensable component of the safety and quality of care of all patients, and
Whereas nurses connect individual, team, and organizational safety goals in all healthcare settings. The demand for nursing services is greater than ever because of the aging of the American population, the continuing expansion of life-sustaining technologies, and the growth of home healthcare services.
Whereas the nurses deserve special recognition for the tremendous job they do, especially during the past year with COVID-19 pandemic and difficult circumstances and the risks they faced. And now therefore, in honor of professional nurses, we hereby declare the week of May 2nd through May 8th, 2021 as National Nurses Week in Clay County. And I would entertain a motion to approve that proclamation.
I'll move, Mr. Chair.
second.
I have a motion by Commissioner Moser, second by Commissioner Ebinger. Any discussion?
Thank you, Mr.
A
Chair.
job well done.
Thank you on
Right.
behalf of all the nurses. Thank you very much. That was quite a surprise.
Okay, all in favor signify by saying aye.
Aye.
Opposed? Very good. Please send our thank you to all of your.
Thank you very much.
Thanks. Yeah, appreciate it.
All right. All right, Mr. Shockley, we have, and this, we did have this before our board here a couple weeks ago, and this is regarding the pledge resolution for operations and maintenance. And I think John had provided us with some information in our packet. And if you want to give another brief, high-level.
Certainly, Mr. Chair, and thank you. Just like to say, appreciate the nurses thing. My mother was a nurse for years and years and years in detox, so appreciate everything they do. So, as just a brief overview, there's been no changes between the resolution that it presented at the last county commission meeting to the final version. In some, I think some of the high-level takeaways, just a reminder, none of the Minnesota entities are being required to pay capital out of local taxes or special assessments. So there's no special assessments in Minnesota. Just want to make that abundantly clear for any of the capital costs. The resolution authorizes the Diversion Authority to enter into a WIFIA loan. WIFIA stands for Water Infrastructure Financing and Innovation Act, and the WIFIA loan is $569 million. The advantages for the diversion to enter into the WIFIA loan are that it is at Treasury rates, which are about 1.59% interest. It's for a term of about 46 years. You get the 46 years because we will close in June on the WIFIA loan. We have 5 years to draw it down, and then another 5 years before debt service starts on it, and then another 35 years of payment. So it gets into a very long term and a very low interest rate. The resolution also authorizes the Diversion Authority to enter into what are referred to as SRF loans. In Minnesota, we have a similar program that's administered through the Public Finance Authority in Minnesota. In North Dakota, they have a similar program. It allows for low-interest loans for water and sewer components of the project. That's about $81.6 million. The resolution also authorizes the Diversion Authority to enter into a master indenture of trust. The master indenture of trust is a trust instrument in which a trustee, the Bank of North Dakota, takes all of the sales taxes and pledged revenues from the Diversion Authority each and every month and applies that to the outstanding obligations. They're a fiduciary, so they have a legal responsibility to do that on behalf of the Diversion Authority and bondholders and the P3 developer. It's also a transparency issue. You have a professional that's administering it. With this large of a transaction, having a trustee in place is really important. And then finally, it also authorizes Cass County Joint to issue what are referred to as refunding improvement bonds. Cass County Joint Water Resource District is the water resource district that actually is buying a lot of the land in North Dakota. And they will be issuing a small tranche of refunding improvement bonds that are paid for with sales taxes, but it just authorizes them to go ahead and do that. Clay County will not be issuing any debt as part of the project. None of the debt of the Diversion Authority can ever be counted as debt of Clay County, so just to make that clear. So whatever the Diversion Authority is doing for debt, it's not a debt of Clay County. So there's no. Or Moorhead. And the resolution also recognizes in the joint powers agreement, the Minnesota entities agreed to pay about 2% of the operations and maintenance of the project. The operations and maintenance of the project won't commence until either 2027 or 2028, depending upon when it's completed. The estimate for 2%, the low estimate for operations and maintenance, 2% would equal $70,000, and that $70,000 would be split somehow between Clay County and Moorhead up to about $200,000, which would be split somehow between Clay County and Moorhead. The resolution gives you 6 years to figure that issue out with Moorhead, figure out how to divide that up, whether it's a percentage, whether it's 50-50, whether it's 20-80, you know, that issue can be worked out. And it just acknowledges that which is already codified in the joint powers agreement. The reason that we need the pledge resolution is when you're dealing with such large amounts of money and loans, everybody wants to make sure that there's no stone left unturned. And so we wanted to make sure that the member entities had authorized the Diversion Authority to go ahead and issue all of this debt. And it's sort of a check the box due diligence. And so I can certainly answer any in-depth questions. I've spent almost 1.5 years working on this transaction, so I can, whatever questions you have, I feel comfortable answering them.
Yeah, I know the discussion between Moorhead and Clay County has started through our MCC JPA group, so I think we'll continue to work on that. I know in terms of the 2%, how it's going to be collected on the Minnesota side, it obviously has to deal with benefited area. And we will work on that, and it was my suggestion that we work with the watershed. They're very familiar with creating those districts for that purpose. I know I talked to Dr. Zimmerman, and And he felt that that was a really good idea to do as well. And I think for those who might be concerned about what this 2% might cost somebody an average home in Moorhead, I brought that up to Dr. Zim, and I said, well, would it be $10 a year? And he said, I don't think it's gonna be that much. So, from a typical home in Moorhead, just to give you an idea, and that might even be at the high range of 200,000 and not the low range of 75,000. And I do want to point out that you mentioned somewhere between 2026 and 2028 that this would start, but the maintenance on that would only be on the portions that the federal government is dealing with. Is that correct? Because isn't the maintenance on the ditch itself the responsibility of the P3 contractor for 30 years?
So, great question, Mr. Chair. So the operations and maintenance costs, you are correct. The operations and maintenance of the channel is handled by the P3 contractor for a period of 30 years. Every year, they provide a invoice for the maintenance and operations costs of the channel. And so the total operations and maintenance of the entire project, including the southern embankment, is what we have in our operations and maintenance bucket. And so both of those amounts are inclusive of that estimate I had provided, either 70,000 up to $200,000. So the overall project doesn't have a tremendous amount of maintenance because the concrete structures are very robust. It's earthen levees that are there's just not a lot of maintenance. The insurance that associated with the project is actually turning out to be fairly reasonable and under what we had estimated. So we're starting to feel pretty good about where the operations and maintenance is. But you're correct. The Diversion Authority will be for 30 years. There will be maintaining the southern embankment and some of the other, like paying the insurance, and if there's ever operations, there'll be cleanup. And the diversion channel would be maintained by the P3 developer.
Okay, and I think for the record too, I think, we've put on the record that the area south in the staging area, for example, and all of those properties that might have to have flowage easements and all of those types of things, it's certainly our board's intent that those people would never be ones who would be paying for this O&M. So I think that's important to at least have for us in our minutes and our record that that's certainly the intent of this board, and we will work on making sure that language is put into anything we agree on.
And just to add some of the mitigation programs that the Diversion Authority agreed to with the upstream, we will be providing crop insurance to producers in the storage area. That's both summer crop insurance and prevent plant insurance. And so that is a rider that attaches to their federal crop insurance, and the authority pays that, so the producer doesn't have to pay that. There's also a business interruption insurance that we're procuring, and that would, and I'm gonna get the name wrong, but I think it's the CH Cooperative down by Comstock. CW, sorry. I knew I was gonna get the name wrong. Those types of businesses would be able to access the business interruption insurance. So if there ever was an event that impacted their business, the insurance would provide coverage for that.
All right. Commissioner Moschel.
Thank you. It's no secret that I've been quite critical of the diversion and the plan and effect that will have on southern Clay County. When I was appointed to the governor's task force, we gathered and heard all of the complaints and concerns, and really, I think, took into account all of the stories from affected citizens in that area. And I will support this today, and the reason I will do that is because the O&M will go to make whole those that are being affected. There is a need for flood protection of the metro, and I identify that and understand that. And the plan has been modified to affect, there will be less effect on those in southern Clay County than before. Approving this allows us to make sure that farms are able to access the insurance that you talked about, that businesses are able to reach out and receive the benefits of the programs that you're talking about, but it also makes sure that the cemeteries are cleaned up and that the land is cleaned up so that farmers can continue with their livelihood. I think that I would maybe go one step further than Commissioner Campbell, and I think that this board should consider in the near future some sort of resolution to ensure that even after this board is gone, we will not burden those affected with any type of fee to go into O&M. I would definitely support that. And I am on the MCC JPA that will continue the discussion to see with the city of Moorhead how we come up with this 2%. But I think the underlying factor is that this is our way to address the concerns that we've heard from those affected for all this time and to make whole going forward. So, thank you.
Very good. We have a request before us, and there's a attached resolution. Is that correct?
And Mr. Chair, if anyone were to bring forward a motion, we do need to have the verbiage written as listed in our memo.
Okay, so we will, if we have a motion, we will do a roll call vote on this.
So moved as stated.
Okay. Motion by Commissioner Ebinger,
Second.
second by Commissioner Gross. Any further discussion? Well, you'll be forever in the minutes for making your motion in a second. Roll call vote, please.
Yes.
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 Motion carries unanimous. Thank you, John.
Thank you.
All right, next we have solid waste, new rates for disposable tires. We can, we're gonna try to get back on schedule here, Kirk, so I'm gonna,
Cut me off, is that what you're suggesting?
I'm just suggesting that you
Abbreviate.
help me out here.
Obviously, you know how I'd like to talk about garbage. So I'm not gonna say anything. Essentially, this is something that came up out at the landfill. Liberty Tires raised the rates for disposal of our tires, and we just want to try and stay whole. So with that, I'm just going to turn it over to Brett, who's the landfill manager, to talk about it just very briefly.
Good morning, Brett.
Mr. Chairman. Yep, so in front of us, we're just suggesting that we change the rates of the tire and rim disposal recycling in order for Clay County to get reimbursed for our costs that are incurred. So I would like to note on the bottom, the environmental fee is built in to the rates that I'm proposing, so no one customer is going to be getting the $15 extra. It's just built in, so.
And that's, so this is all because Liberty raised their prices as well, correct?
As you can see, some prices are raised, but some are also decreased. So just market change.
Yeah, Commissioner Motion.
Thank you. Both Commissioner Campbell and I were present at the SWAC committee, and we had a long discussion on that. I do think it's important to note that, you know, the truck and the super single tires as well have gone down, and so it really is just a reflection of what we're being charged, we're charging out. I think there are businesses that utilize this service countywide. We're also trying to make it as easy as possible so that Mr. Overbo is not having his crew called out to the ditches because people are dumping tires. So I would definitely make a motion to support these changes.
Second.
We have a motion by Commissioner Mosel, second by Commissioner Kaylee. Any further questions?
Yeah.
Mr.
Is
Gross.
Liberty Tire the only one that we deal with? Is that,
Mr. Chair, Commissioner, they're the only one, they're the main one that they haul all the tires. And they do it for most of the entire region. So essentially what they do is they take the tires down to the Twin Cities and they sort out the tires, and some they can still try and use and try and resell. Some of them they chip up and they sell for TDF, tire-derived fuel, and they burn it in a concrete plant down in Wisconsin.
thank you.
Any further discussion? All in favor signify by saying aye.
Aye.
Opposed, the same. Motion carried.
Just one other thing, very, very quickly. I just want to let you all know that all the drawings for our transfer station were done last night at 11:30. As we talked about, we asked to have the drawings done by yesterday. The specs are going to be done today. I talked to construction engineers this morning, and the bid for subcontractors, there's going to be in the papers tomorrow. So we're one day behind, but we're moving ahead.
Thank you.
Thank you.
Joe? You're looking for a request to advertise for bids for the storage building.
Yes. Good morning, Mr. Chair, board members. Yeah, I'm coming today. The goal is to get permission to advertise for storage facility that we've been talking about in the both building committee and we've mentioned at board. The goal is to, I wanted to switch some dates around here, I guess. I originally said May 10th through the 31st, but with Labor Day and everything, I'm requesting to run an ad for May 6th through the 29th, and that would cover, we're basically requesting to ads for the building itself, and then today I would request that I move forward as the project manager on this. This would allow me to quote out the rest of the projects as well to kind of, we originally were going to hire a company to give us proposals and stuff, and the initial numbers didn't come back in our favor, so we're switching directions and doing it that way. So I guess June 1st would be when we would get these bids in. We have to advertise for 3 weeks, so.
And again, these are included in our capital plan. One of the reasons why we wanted to get this done is because of the market conditions with steel buildings and those things and how they're rapidly changing by the day. So I think it's important that we get this moving, so.
When would the bid opening be?
Well, the bid opening would be June 1st, and that's where we'd have to figure out if we decide that day. I think, like,
Okay.
yeah, like Mr. Chair said, that we're trying to nail down the metal prices and the building costs. So June 1st, we would get the bids. We'd have to figure out if we could analyze it there and approve it on that same day too somehow. So we're not a week behind on this. So prices are jumping every week, and so we want to nail this down. But prices come in high, then obviously we don't have to accept it either as well. So we're not.
Commissioner Mojo.
Well, you alluded to that a little bit. I think that it's our responsibility to, be as responsible as possible with the dollars that we spend. And I'm significantly concerned that if it makes sense to build this summer based on what costs are doing just in the last, couple days. We have a member on our SWAC committee that sells steel buildings, and they are now advising their customers to wait because of this bubble that we're seeing. And so I understand that we need it. I think we should be prepared with a second option based on what may or may not happen. And maybe that's, leasing some sort of space for a year to get us by. I don't know what it is, but certainly I'm concerned about what prices are doing.
Yeah, and we could, Commissioner Mojo, we could talk at the building committee level and get that contingency plan. So June 1st, we're not forced to do anything and figure out what we want to do there, so.
I think too, these prices come in high. I mean, we got to look at some sort of plan. What are we have to get out of our present building, so
Yep.
we have to come up with something
Yep.
different other than building something if this is not going to work out.
Well, and that may just be doing site work and pouring concrete and just holding off on a building. I don't know what that does, but
Yeah.
thanks.
Yeah.
Well, we have two requests here. First one would be a motion to advertise for bids for the site, parking lot, building, and building slab.
So moved.
Move ahead with that.
Okay. All right, we have a motion by Commissioner Gross, second by Commissioner Ebinger. Any further discussion? Seeing none, all in favor signify by saying aye.
Aye.
Opposed, the same. Motion carried, and the second motion is to approve Joel Olson to be the project manager.
Move to approve.
Second.
Motion by Commissioner Cayley, second by Commissioner Ebinger. Any further discussion? All in favor signify by saying aye.
Aye.
Opposed, the same. Motion carried. Thanks, Joe.
Okay, thank you.
Go. All right, our next item is a request by Sarah Peterson to waive penalties and fees for late taxes in Glyndon. And was Lori going to be up here? I see she was going to be the, oh, there she is. Okay. Good morning, Lori.
Good morning. I'm actually not here to make a presentation. I'm just here to answer questions.
Yeah, okay, yeah, because we do have some information in our packet, and we have the written request from Sarah Peterson. It looks like there was original one on the 12th of April and another one on the 21st of April. And I see we have some folks from Glyndon here as well.
It was my understanding they were supposed to be here this morning, but they aren't here. Sarah and Daryl, I guess. But.
Is Sarah here? I don't recognize half of you folks with masks on, so I have to ask.
This property is in the process of forfeiture. They've signed 2 contracts for deeds, and those are currently the only payments that have been made on this property since they got it out of a separate forfeiture process.
Can you give us a little bit of history, Lori, on the history on the payment of taxes on this property?
Well, this originally forfeited a number of years ago, and in 2014, they purchased the property through the forfeiture process. And after that was in 2014, they did not make any payments at all until we started the forfeiture process again, at which time they came in and signed their first contract for deed in 2019, which means the taxes do get divided into 10, so they pay 10% down, but they also have to pay that 10%, plus they need to keep their taxes current. In 2020, they came in, they did not pay their current taxes. They signed, they signed a second contract for deed in the beginning of 2020, which meant they paid another 10% down of the remaining taxes. And they also had to pay the 2020 taxes before the end of the year, which they did not do. And so you can only do a confession of judgment. Did I say contract for deed previously? I meant confession. You can only sign that twice. And they still haven't paid their 2020 taxes. They did bring a check in last week to cover everything, but we were already in the forfeiture process. So at this point, they would need to pay a full $53,000. That's what the amount is right now.
I just have a question on what the check, what do you mean to cover everything?
They brought in a check that would cover the total 2020 taxes.
Okay, but not any of the back taxes?
No. But they already made their 10% payment last year, so they didn't need to make another 10% payment. They just needed to keep their taxes current last year, and which they did not do. We gave them an extension till March 31st. They didn't bring anything in then, and we gave them till April 15th. Also didn't bring a check in, and then they brought it about a week after that.
All right, Commissioner Gross.
I'm gonna go back to where a couple months ago with the same type of request, and going back to our policy for waiving penalties and interest. You know, in the event of a property owner's serious illness, hospitalization, or death, in the event of disasters. And if I read her letter, there is no serious illness, there is no event of disaster. I mean, she refers to, I think, the epidemic or whatever, but if that's gonna work, then I'm gonna sign my name to this too, then get my taxes off. Because, I mean, everybody had the epidemic, so I don't think that's a reason. I mean, I just don't agree with there's no statement here saying why the taxes aren't being paid.
I agree with that. I also know that if there's this board in the past, if there's been a history of failure to keep taxes current, then the willingness on the part of the board to forgive or to abate penalties and fees, it's not our policy to do it, and it's our precedence not to do that. I have some concerns that this could just be an ongoing, see you next year for the same type of an issue. It seems to be that seems to be the pattern here. So, Commissioner Mojo.
Thank you. Our board meeting minutes from December 27th, 2018, we addressed this issue as well. And then I had made the comment that this was a hardship case and had required some payments. Those payments never came in,
They
correct?
did not.
Thank you.
I don't know if the local government entity cares to speak. I don't know that it's up to you if you want to do that or not, but I see Mr. Norman. Good morning.
Morning.
Good to see you.
For those who don't know me, my name is Ken Norman. I'm the city attorney for Glyndon. This situation is very well explained by Lori Johnson, but essentially this property has been a nightmare for the city of Glyndon for several years. We recently obtained a judge's order to clean up the property, at least the exterior of the property, because it was found to be a hazardous site. The property involves a home that was moved from one side of the Highway 10 to the south side of Highway 10. There were plans that he was going to rehab the property. He obtained building permits. He has never complied with the building permits, and it's important to also note that a certificate of occupancy has never been issued for this property to be used as a homestead because, simply put, he did not meet any of the requirements that the building inspector had imposed as a result of the building permits.
All right. I do want to ask Steve, I know I asked if the request, the individuals were here. They're not online, are they, by any chance that you know of?
They're not, Mr. Chair.
Nobody? Okay, all right. All right. Any questions of Glyndon?
I'll make a motion to deny.
Second.
We have a motion by Commissioner Gross, second by Commissioner Ebrich to deny the request. Any further discussion? Commissioner Gailey.
Just one more question. So you said a certificate of occupancy has never been issued. Can we confirm that the family is not living in this residence? I guess it's not a residence in this
They're not
building.
supposed to be. The building is essentially boarded up.
Okay.
They may have tried, I'm told, to live in a trailer on the property, a camper, which quite frankly is not a safe situation as well.
Thank you.
Any further questions? Seeing none, all in favor signify by saying aye.
Aye.
Opposed, the same sign. Motion carried, all right. So we'll send him a notification then, Laurie?
Yes, we'll do that.
Thank you.
Thank you. All right, our next item is presentations and proclamation for Mental Health Month. And we have, first up, we have Children's Mental Health Advisory Council. Carolyn, good morning.
Busy morning. Thank you for having us here today to present our annual LAC report to you. I'm not going to go over the whole thing because I know that you're trying to get back on schedule and it's quite lengthy, the report that I wrote for you. But I just wanted to note that the LAC continues to be a really strong advocacy group. We've got a lot of vested members, and those members are listed on the first page of your report. We've been doing, new this year, we participated in a youth survey and got some interesting comments from our youth about how to address their mental health issues and how to get them involved in in identifying their own services and stuff. So we were very thankful that the juvenile center allowed us to come in and, or via the internet, we interviewed some of their residents as well as doing some that have just been out of foster care. So we've had an opportunity to talk to youth this year, which is really great. We did our parent survey as well as our professional survey, and for those of you who have been on the board for a while, you'll know that when we look at our barriers, we're still looking at do we have enough funds? Our funds are limited sometimes for services. We have the same barriers that I've been talking about every year that I've been here, including transportation, the financial components of it, and some interpreting that needs to be done. We are really in short supplies of some pediatric psychiatrists in our community. It's a high need, and one that we need to keep pushing on the state a little bit as well, just so they can understand our needs out here in the rural communities. Some of our recommendations that we have, COVID has really heightened the awareness of mental health. I'm sure you've all heard the stories and seen some of the reports that mental health needs are really increasing in not only in adults, but our children as well. And we are wanting agencies to really be prepared. I think now as kids get into school more and more, we will see some of those needs really come out, and so we need to be prepared to have some early intervention services for those young kids that are in school. It's really, as you know, the pandemic has really taken a toll on our families. Wait times for our Rule 79 case management need to be reduced when possible. This is really, when we talk about all of the barriers that come to accessing mental health, including that transportation piece, that Rule 79 case management is really the key. That's what we hear over and over again at the LIC, and we see it in our survey results as well. If you can get a case manager, they can help you with reducing all of those barriers. So trying to keep our wait times down. Sometimes individuals do have to wait while they can gather the necessary medical information that they need to qualify a youth for that particular service. I've been really pleased, and the LIC has been pleased to hear about our mental health agencies and how well they are doing in trying to keep up with the demand for mental health professionals. They've been hiring frequently and in a constant kind of mode, and have been fortunate enough to find some of those case managers and mental health therapists and practitioners that they need. So I'm really pleased to see that, as well as the LIC is pleased as well. We need to continue to fund and support those important social service programs such as respite, the coordinated intensive bridging services, and then case management. Our dollars are always short. This board has always been good to answer some of those needs, and we appreciate that as well. We appreciate working closely with social services on many of these issues. The transportation needs, actually the transportation was much better when, due to the COVID, they eliminated all of the fees to ride the city buses, and so we saw an uptick in families being able to use that and get to their appointments independently. So if we could somehow wave a magic wand and not have to have families, individuals pay for that bus. It's enough that they have to ride it sometimes for an hour just to get to an appointment, but on top of it, having to pay is another barrier for them.
So Carolyn, so if I can just ask a quick, so the issue has been more about the cost involved with the transportation as opposed to the availability?
Well, I think that it's not necessarily the availability, it's the length of ride that some of our families have to take, especially if you live up north and you're going down south to Lakeland, which is the community health center. It's an hour bus ride with some transfers in there, and that is difficult to do when you have a child with some significant mental health stuff. And it's not something that you can just, do when you hear that your ride has been canceled on you, that you maybe had a friend that was going to take you and then all of a sudden they can't, and now you're scrambling to make other arrangements. But the cost is prohibitive as well. Our agencies are working with families, trying to get them to understand how to go through medical assistance and some of their other medical plans in order to get reimbursed for those expenses, but you have to have that money up front to pay that fee going into the bus and stuff. So I think it's both. Yeah.
Commissioner Kaylee.
Carolyn, is an Uber or other things like that reimbursable? Do you know?
I believe that it can be through our medical plans that they have. The issue with the medical plan is it has to be approved at least 24 hours ahead of time. And again, if you've got a ride and that ride cancels, then you're kind of out of luck, but it does qualify with that. And, you know, we've talked about transportation for a long time, and I think we're doing our best, and I think providers are really trying to do their best to answer it, and I just think it's just going to be an ongoing issue with that. So, and the last recommendation.
Carolyn, I might just follow up on that. I appreciate you bringing that up and Jenna's question as well. You know, the Lakeland Board has talked that through a lot as well. I think there's room for us to do better. My question is so we're talking access times all the time at Lakeland, and maybe we're getting into the weeds here, but we talk access times. And so if someone has to have something approved 24 hours in advance, and the provider has a cancellation and says, I can see your child today, is there any way they can go back on the approval of that if it's a short-term notification?
Not that I'm aware of.
Okay. That's interesting. Yeah. Thank you.
I'm aware of. So, and then the last recommendation we have is just to continue to promote our mobile crisis program. Every time we survey, we find there's lots of folks that still don't know about that program and know all of the benefits that can come with that. And it's just a really vital program in our community. So those are our recommendations. I want to correct just one error that I have in the report under our successes. School-based mental health services are available in all 5 of our county schools. They vary depending on what the school needs, but they are available, and they are growing by leaps and bounds for those students. It's been found to be a really positive way to get mental health services to kiddos when they're in school. Of course, that's been a bit of a challenge with COVID when they're not always in school, but providers are doing their best to try to connect with them via virtual when they're not in school. So that's my report. If I can just briefly just say, some of you know that I am retiring from my work at the Collaborative. And so this is my last board report with all of you. I've been doing this for 24 years, and I have come to this board many of those years. I'm not sure if I want to count all of them, but I have been very blessed and fortunate to work in this county who really believe in family and children and put them first. I've always found the board to be very responsive to our information and our requests. I have enjoyed very much working with social services, and some of you know that I used to coordinate a statewide effort in parent advocacy, and what we have here in Clay County is very unique, that we care about families and that we have a very active LIC that reports to the county board. I did not see that as I traveled the state, so I want to thank all of you for that, and I want to thank Rhonda Porter specifically for being so great to work with me and to support our LIC and to bring me in when she needed just another voice at the table, so I really appreciate that.
Well, thank you, Carolyn. I'm hopeful we'll have you back here before your time is up to greet you and thank you again, but
thank you.
Thank you for your report.
You was just honored with a recognition for your Woman of the Year, whatever you call it, but.
Woman of the YWCA gave me an award for Woman of the Year in Youth Advocacy, so.
Oh, very nice.
Congratulations.
Thank you. That was quite a humble process and very honoring to accept that award, so.
Commissioner Mojo.
Carolyn, Our county and entire region is better because of the work that you've done. And there are thousands and thousands of people that you have affected in such a positive way. And so if I can have a life with even a percentage of the positive work that you've done, it would be fruitful. But just thank you so much for all that you've done and continue to do and you will do after retirement. But we're lucky to have had you in this snippet of time to lead the programs that you have, so thank you.
Thank you. Thank you for your kind words. I appreciate that.
Thank you.
So, we do have a proclamation. I don't know, do you have that in front of you? Or I have some copies that need to be signed.
With my lack of vision right now, what's that?
Do you want me to read it?
Yes, please, if you would, Commissioner Moore.
Thank you. Mental Health Month 2021, the Clay County Proclamation. Whereas mental health is essential to everyone's overall health and well-being, and whereas all Americans experience times of difficulty and stress in their lives, and whereas identifying and intervening and addressing problems with effective treatment earlier improves children, youth, and adults to lead full, productive lives, and whereas Clay County has made a commitment to community-based systems of mental health care for all residents and has appointed the local mental health advisory councils for adults and children, and whereas each business, school, government agency, healthcare provider, organization, and citizen share the burden of mental health problems and has a responsibility to promote mental health wellness and support prevention efforts. Therefore, we, the Clay County Board of Commissioners, proclaim May 2021 as Mental Health Month, and specifically May 6th as Children's Mental Health Day in Clay County, Minnesota. As Commissioners of Clay County, we call upon the citizens, government agencies, public and private institutions, businesses, and schools in Clay County to recommit our community to increasing awareness and understanding of mental health, the steps our citizens can take to protect their mental health, and the need for appropriate and accessible services for all people with mental health conditions. Adopted here the 4th day of May, 2021.
All right, somebody care to move that proclamation?
So moved.
Second.
Moved by Commissioner Cayley, second by Commissioner Ebinger. Any further discussion? All in favor signify by saying aye.
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 Opposed, the same. Motion carried. Thank you, Carolyn.
Thank you.
Pass those down to Steve to sign, please. All right, next we have our Allison. Is Allison? There she is. Good morning. Adult Mental Health LAC report.
Well, I do not have a report for you today. Over the past year, we have not been meeting due to COVID. I've learned that the Family Service Center meeting rooms have opened up, so we began re-meeting via technology in March, and we will be starting to meet again this month at the Clay County Family Service Center.
Good.
That's all I have. Unfortunately, I did not have the technical expertise to figure out how to meet remotely through the past year until just recently. So we're glad to see the Family Service Center open for meetings again.
Good.
Thank you.
Okay. Thank you. Okay, next, Place for Hope. Wellness Recovery Center. Daryl. Good morning.
Morning. Just passing out since we last met 2 years ago, we've created a brochure, and also there's our yearly statistics for last year. Just a few of the highlights. When the pandemic hit, we tried to figure out what to do. So A lot of the agencies were closing as to the distribution of food in the Fargo-Moorhead area, so we decided to take that on as our project. From basically April through December, we distributed about 250,000 pounds of food. We worked closely with the Great Plains Food Bank. The total number of people attending our club this last year, which includes these numbers, is 4,704. We were open 241 days. We ended the year with 173 members, and that's up 19 from last year. So we're still getting members during the pandemic. I did provide meals for the volunteers, and we prepared 2,293 of those. I could not have done this without the help of the volunteers. Worked very closely with the Dilworth Lions Club and the Fargo-Moorhead Sertoma Club. They have contributed 4,619 hours to enable us to distribute this amount of food. It's a lot of work, and it's a lot to do for one person, for kind of the one-man band. We helped 3,713 families, or that turned into 8,820 individuals. We have 3 new board members, and just for the highlight of the year, we did a lot of grant writing, and we ended the year with a $47,216 profit, which is kind of unheard of for us, but it helped. We're getting our name out there. We're kind of at the dilemma right now of what do we do. We've allowed our members to come in one-on-one to work on computers, do anything that they need to do in the club. But we're kind of looking at opening back if they have their immunizations, and we're seriously considering doing the food distribution because it's really needed in the area. We found that about 10% of the people that came in were from the North Dakota side, and about 90% were from the Minnesota side. We're working with the Great Plains Food Bank right now to try to do a little deeper food rescue from the restaurants. A lot of that stuff is being thrown out. There was a couple agencies that were doing it, and they are discontinuing it just because they don't have enough people to do it. If we take this on, we're going to need a little more space. So we're looking right now to see what we can do, even looking for a building for ourselves. So I'm working with Great Gate City Bank, try to see what they might do to help us, and any other the agencies in town that work with building. So other than that, if anybody has any questions.
Any questions for Daryl?
I guess I would be remiss if I didn't ask if there's any extra funds. We could certainly use them for extra people to help. Thank you.
All right, thank you, Daryl.
Just one comment, Daryl. I'm on the Cass Clay Food Partners, and so to hear that you pivoted in the pandemic to address food needs, I think is really appropriate. That's a trend that we saw a lot of agencies focusing on because they realized at the heart of it, if you're not fed, it's hard to stay mentally healthy. And I commend you for that. I think that the Great Plains Food Bank as well has been really good about working with different organizations such as yourself to help with food accessibility. So thank you.
Yep. I should tell you, within this last month, I've had 2 individuals digging through our garbage bins for food. So, of course, tell them to throw it down, come inside and get food. And now one of them we just had our fundraiser this weekend, and one of those individuals actually came in and helped us set up and whatever. So I think what goes around comes around.
Thank you.
All right, very good. Thank you. We'll move on to our committee reports. Commissioner Cayley, do you want to start this morning?
Sure. Last week, Tuesday, the insurance committee met after board. There were Lots of questions from committee members about possible changes to the insurance plan options, and we had Lakes County Service Co-op here and insurance reps to answer a bunch of those questions, and you can report more on that if you care to. On the 28th, there's a subcommittee of our Early Childhood Initiative that really works on the Kids Fest event, so I met with them out at MB Johnson to talk about Kids Fest, which is going to be May 15th from 10 to noon. Outdoor, COVID-friendly environment for kids just to be outside and play. There will be kites and a number of activities where we don't have to be touching a lot of things. So for example, a chalk obstacle course, a story walk, the library book truck will be there, and lots of fun things. So again, that's May 15th at MB Johnson Park from 10 to noon. Then on the 29th, the Clay County Collaborative met, and we approved offering the position to Carolyn's replacement, Carolyn, who was just here reporting. She's a coordinator of the Clay County Collaborative. We also reviewed fiscal year 22 applications for funding, the fiscal year 22 proposed budget, and we will be revisiting a few of those items again in June. That concludes my report.
Thank you. Commissioner Gross.
Okay, on Wednesday, we had our building committee meeting, and we pretty much discussed that with Joel's and brought up today, so that's been covered pretty good there. Yesterday morning, we had the Minnesota Rural Caucus meeting. I'm sure Cheney's got a lot to report on that, but a lot of stuff was discussed on transportation. We had Ms. Donahue report on how the tax bill is going on that. Other things, broadband was kind of discussed. Another big thing that they're discussing is the wild game processing with, with a lot of hunters in Minnesota, well, all over, I guess. But I think they're trying to get that you can't process meat in your own garage anymore. So that there's a lot of interest in that bill, how that's going to go. Another big item of discussion was the Enbridge settlement, where it's going to affect some counties quite a bit if it goes the wrong way there. That it's going to cost some. They're trying to decide who's going to pay for that assessment. If it's going to be the counties, the townships, or the state. So, and that concludes my report.
Thank you. Commissioner Mojo.
Thank you. Last week, I had AMC Extension. We had our final candidate interviews and reviews and discussion for the Northeast and West Regional Directors. Those positions will move into the next phase, but I am not on any more interview panels, so that would be nice. We had the SWAC committee on Thursday. Had a request from the city of Felton for aid in a new recycling center that they're looking at building. We will, as a committee, look at score funding breakdowns and then our policy regarding partnerships with cities. We addressed the landfill prices piece that we had from Brett and Kirk. Commissioner Campbell gave an update of the Perham facility, and we talked a little bit about the recycling or transfer station. That afternoon, I had a meeting with the city of Moorhead and our Clay County. We had staff present to discuss about that joint transfer station, who will operate it, who will own the equipment, et cetera. Those discussions need to happen. I think we have a pretty good plan laid out with proposals that will happen towards the end of the summer, I think, for boards to plan for their financial pieces. A good update from Commissioner Gross on the MRC conference or committee that we talked about. Other items of note, rural hospitals are really in the hurt big right now, particularly because of the pandemic, but leading up to it. They're having difficulty filling shifts with nurses, as we all know that nurses, there is a shortage of nurses, so most of the employees that they're seeing are out-of-state transfer or
what are the remote, no. What are the nurses that just, traveling nurses, that's it, thank you. And then the other piece that we talked about is the local emergency management grants. There are a lot of bills that a lot of different committees are tracking, so I think we have a pretty good start on that, but that concludes my report.
I had one question on, you said in the city of Felton there
Yep.
were funds for it? Because last year I was working with them a little bit there. I went to a meeting. Are they building one or are they, what's the plan there?
Well,
Go ahead.
So Councilmember Rader presented on what their plan is to tear down the old tax forfeit building that they talked about and replacing it with a indoor recycling center. And so they do have some preliminary quotes that were attained, but as I said earlier with Joe's presentation, they're skyrocketing prices. So I think they were just looking at if there were funds available from the county, if there's any way we could help out that way. I think there's been discussion that we potentially have helped on a small percentage other cities in the past. So I think we're going to talk about that.
Good.
But also had identified that because of the American Recovery Act, they have been awarded funds, federal funds that possibly they could use there or partnering with Felton Township. But I think it was more just a conversation about, it is an identified need, ground level discussion about financing.
Oh, good.
I'm
glad to hear that.
I think Commissioner Gross, if I can follow up on that too. So the recycle dollars that we have in Clay County, there's I think we get in the area of about 125 to 150,000 that comes through SCORE, which isn't enough. We've argued that for quite some time, that they collect upwards of $90 million right now, and only about $18 million of that goes back to counties, and the rest goes to the general fund of the state. And it's supposed to be, and it's based on taxes collected in solid waste. So we have that issue. So then we, as a county, we put in roughly through solid waste in our enterprise fund about $500,000 additional dollars into recycling. And we as SWAC had created a subcommittee a while back to make sure that we came up with a process on how those funds would be distributed, because before we just basically paid everybody based on their usage, but in some instances there was no stopgap in there based on the budgeted amount. So we needed to protect that so that we didn't go over budget. And so we have a formula in place for each community. And, in the case of Felton, they get, based on their formula, they get so many dollars of that recycling dollars to use.
Okay.
And so, now obviously that's not enough to build this building. But one of the things that I suggested that maybe, and it goes back to kind of like our, when I talked about the wheelage tax dollars, a portion of it goes back to communities, and they have a period of time to use those funds. And I did suggest that maybe based on a cost share, if it was within reason, that we could probably help them out, and then SWAC would be reimbursed over a period of time based on future years' allotments. So those are things that we're discussing right now. We'd have to make sure, of course, that the funds within the solid waste can handle that advance payment. So, but we're working. I think we had a really good dialogue with Felton.
Because we were working on that last year and hoping to get some funds to build that building, but at that time too, wasn't enough funds to build what they want, so.
Yeah, so we're looking at, now obviously if, I think, what was the dollars that Felton gets annually? It's not a, was it like a couple $1,000s or something like that they get out of the recycling? So it would take a number of years to replenish 75,000, and so that's one thing, but I think we all need to continue talking with our state legislatures to reappropriate this score funding back to its original intent and its original dollar amount. They cut it from 36 million to 18 million, and now they're collecting upwards of 90 million. So it's a windfall for the state for other uses, in my opinion anyway. I'll just say that. But did that conclude your, are you, okay?
Thanks for the update.
You're welcome. All right, Commissioner Binger.
Thank you. Tuesday, the 27th of April, myself and Mayor Carlson and Dan Molly from Moorhead, along with Steve Larson and Commissioner Campbell, had a meeting regarding some of the issues that are coming up with the Triple RDC, the Red River Regional Dispatch Center. This was in preparation for meeting later that day, where Mayor Mahoney from Fargo, Mayor Carlson from Moorhead, Cass County Commissioners Sterling and Peterson, Fargo City Attorney Eric Johnson, Assistant City Administrator Fargo Mike Redlinger. We also have West Fargo Mayor Dardis, who was with us virtually. And we had very productive and long discussion following a presentation from the Fargo Fire Chief, Steve Dirksen, regarding some of the options that the dispatch center is looking at right now. They've outgrown their current location. Actually, outgrew it about 10 years ago. And need to look at some of the options for developing a new dispatch center. We discussed at a very 10,000 foot level some of the construction and development ideas. We also addressed some of the governance issues, which have been brought up lately because Minnesota maintains equal voting power within the Board of Governance with the state of North Dakota. We addressed that. There is a need, I think, and Commissioner Campbell has identified it, where elected officials who have a fiduciary responsibility participate in talking about capital and budgetary funding. And that's going to be a conversation later. But we set up a group with all governmental entities to where we're going to have recurring meetings and continue to look at the options. Right now, I think our primary focus is on developing a new dispatch center, how to pay for it, where it goes, what it's going to be. That's the primary. I think the governance will be addressed at some point, but right now we've got, I think, more pressing mission to get this a sufficient dispatch center built. So that'll be developed as we move along, but right now the meeting went quite well. Monday the 3rd, yesterday, Commissioner Campbell, Steve Larson, James O'Donnell, and Josh Swanson from the juvenile facility. County Attorney Brian Melton met with Representative Keeler virtually regarding some of the issues we've seen with pending legislation in House File 947 and House File 922 that have been addressed in our commission meetings. Also, Representative Keeler presented Curtis Shanklin, who's an assistant commissioner with corrections, and Katrina Dexter, who's working with Department of Corrections regarding equity, or I can't remember her exact title, but they presented on behalf of Representative Keeler. And we had a fairly lively discussion. Representative David Pino, who I'm familiar with from working, he did a lot of really good work with human trafficking. And he was one of the authors of the files in question. And they presented their explanation, concerns, and what they identified as priorities. We talked for about an hour and a half and got about halfway through the topic. So we're going to meet again next Monday. There was no resolution. I think our position and our staff's concerns are still there. And the explanation on what the legislation's intent was put forward. I still don't see a resolution in the conversation, but we're going to continue, which I think is a good thing. That concludes my report.
Thank you, Dave. Okay. On April 27th, we had our insurance committee meeting, and I would like just to bring Darren up for just a minute to give kind of a high-level overview about what's going on in this area right now. Obviously, we work with Lakes Country Service Cooperative, and they put out, with all their other cooperatives a bid for administrative work on behalf of, and for years they've been with Blue Cross, and the new low bidder was Medica to the tune of, was it $80 to $100 million savings in admin. Do you want to just kind of give a brief update on where we're at with that and what challenges we have coming up?
Sure.
Thank you.
I'm not always good at impromptu, but this is.
Well, yeah, and
my best.
I just kind of called them up.
As Commissioner Campbell said, we had a meeting last week with the insurance committee, and we had invited Jeremy Kovash and Dan Weir come in from Lakes Country Co-op, who we currently is our provider for our health insurance benefits. And as Commissioner Campbell said, they went out for bid. And as you probably know, we've been with Blue Cross Blue Shield for many, many years, as long as I've been here, and probably many years before that. And so when Lakes Country Co-op went out for bid, actually the bids came in, and Medica was far and above the best choice for us because of a savings in their administrative fees, something like 80 million or $100 million. They also have a guarantee that our plans would all stay the same, and also that the doctors and clinics that we're currently using will be honored by Medica. Now, that will have to be seen and proven yet, because there may be some clinics and doctors out there that don't honor Medica, but they will actively try to get Medica into their, or those doctors into the Medica system. So the county has a couple options here. The one option is that we could stay with Lakes Country Co-op and switch our health benefits over to Medica from Blue Cross Blue Shield. There is another option that we could just stay with, leave the Lakes Country Co-op and stay with Blue Cross Blue Shield under our own plans. And also, we have an option if we want to really look at going self-insured. As you probably are aware, many years ago, we hired a consultant to work for us, Steve Smith. He's with NIS, and he has helped us with a lot of these decisions going forward. And he will be helping us with that in the future as well, on what would be the best option. So we'll be looking at our own plans, our programs, and also, you know, is it better to stay with Blue Cross Blue Shield or Medica? All of this will go through the insurance committee. We'll probably be having monthly meetings, if not more than monthly, because we're really under a tight time frame now, because we have to get everything done ready and for open enrollment starting in the October timeframe. So there's a lot of things that we have to do between now and October if we're going to be changing plans, changing companies, and changing co-ops. So that's kind of where we're at right now. We'll be working closely with Steve Smith. He's going to give us some more information on what Blue Cross Blue Shield has to offer, because of course Blue Cross Blue Shield is really going to want to keep our business as well. So I think overall we're in a pretty good situation, whether we want to stay with Lakes Country and go with Medica or Blue Cross Blue Shield. It's created a little bit of a competition there, which is always good for the county, I think, as far as costs go. So that's kind of the over-the-world impromptu speech.
Well, sorry for putting you on the hot seat with little notice, but I knew you could do it. So.
Okay, not a problem.
Well, how often do we switch companies?
Not very often. They have to go out for bid every 4 years, but Blue Cross Blue Shield has always come in.
So it's every 4 years.
So this is the first time in I think they said 15 or 16 years that Blue Cross did not.
So for the admin, Commissioner Gross, you know, we've been partners with Lakes Country Service, and they're the ones who do the bidding. And for all these years, Blue Cross came in as the low bidder. Now, in this particular case, this time around, there was a significant difference in all of the admin costs. And the one other part of that, I think Medica also agreed to hold those rates for, I think, 4 years.
4 years, right.
4 years, so.
Okay.
You know, so there's some significant things there, and I think, you know, the primary concern on behalf of, you know, all of our employees is that the policies that we have in place and the coverages that they have and the deductibles that they have, we're concerned that they all, they certainly don't go down in value, you know, for what we get, so, and there's language within our contracts that we gotta make sure that we uphold, so we do have a lot of work to do, and a short time to do it, so.
They also have the wellness programs that we're currently using as well. So a lot of it is similar. I actually got an email from Stearns County who has gone to Medica as well, and they said the transition was extremely smooth, and they're very happy with Medica at this point. But like Commissioner Campbell said, we have a lot of work to do ahead of us to see what's best for the county. So.
Thank you for that.
Okay, yep.
Darren, sorry I put you on the spot there, but. All right, and then, let's see, so that was, on the 27th. We did also then have the meeting that Commissioner Eberlinger talked about with dispatch that same day. Then on the, 28th, I had a Building Improvement Committee meeting. I think Commissioner Gross, you reported on that. We did go over all of the things. We did get into a little bit more depth on some of Dave Overbo's items within the plan, and could any of those dollars be modified? And so there's some discussion there in terms of the outlying buildings that he put in there. So we continue to discuss that. On the 28th also, Prairie Lakes Solid Waste. I guess the only thing to report there is the $2 million bond issue that we did to put all of these improvements in place. Those improvements are almost complete. And there's the Brian, the operations superintendent, said that plant is probably running as good as it ever has, which is really nice to see. The cash is in good shape, which is something we can't say used to be the case. The $1.1 million bond payment that was due on May 1, we had cash to cover that bond payment, which is something we didn't do before, which is good. Then we had, on the morning of the 29th, we had the SWAC meeting, and I think Commissioner Mojo talked about that. And then we had the, Monday, we had the juvenile meeting, juvenile detention meeting with state legislatures, as Commissioner Amier talked about, and you know, I think we had a really good dialogue, and I don't know if there's if it's just a verbiage thing that everybody's having trouble with, but I think we're going to come back next Monday, and I think they scheduled an hour and a half again next Monday to go over some more of this, and hopefully we'll gain some ground on that. That concludes my report. Steve, do you?
I do have a report, Mr. Chair. Before I start, though, I just was notified that Sarah Peterson and Daryl have shown up. I don't know what the board's wishes are, if they would wish to hear them out, or if they've missed their time frame, but I want to start out by bringing that forward.
I guess at this point in time, the subject has been dealt with. They had a time frame to be here, and I mean, they can always ask to come back again, but at this point, I would say that we've made our decision.
Okay, thank you, Mr. Chair.
Unless other board members feel differently.
I think if they got more stuff to present, they should present it at another meeting, and so we can look it over too, and
All right, I think you can let them know.
All right. Thank you, Mr. Chair. On last Tuesday, I participated in the insurance committee that Commissioner Campbell and Commissioner Cayley have spoken about. I also participated in the meeting with the City of Moorhead in regards to the dispatch, regional dispatch center. On the 28th, I participated in county management. We heard vaccine updates from Kathy and her staff. We had board discussions on returning to work, the COVID sick leave policy, our management retreat. We also heard from Rory Schmitz on him looking to collect some information on technology services from our department heads. On the 28th that afternoon, I participated in the building committee meeting with Commissioner Campbell and Commissioner Groth, I've already addressed. On the 29th, I participated in the SWAC meeting that's been fully covered, and also the discussion with the City of Moorhead on operations of the resource recovery facility. On the 30th, I had multiple correspondence with Kent Severson, our food, beverage and lodging licensor, and concerns with a citizen brought forward, I think, to a number of you. I believe that we came to a resolution of that concern. On the 3rd, participated with Commissioner Campbell and Eberger in regards to the juvenile center legislation discussion. Again, I think there was a very nice dialogue. I would concur with Commissioner Eberger in that at least our topic of discussion this past week, the Department of Corrections already has the full capacity to look over some of through licensing, and so I'm not sure why we would necessarily need legislation, but I think it was some very good dialogue, and we'll look forward to continuing that next week. Participated in a number of meetings with, or a number of discussions this week with Joe Olson. Also, yesterday participated and spoke with Brian Melton on a series of county issues. Just a couple different updates. Through the diversion project and part of the permitted project, some work has to be done on the Drayton Dam. And as the MCC JPA, we have a responsibility to look through the mandatory environmental assessment, and so just a notification from that standpoint. Today is the first day of a 30-day public comment. Citizens who are interested can go to our webpage in our spotlight section to find some additional information on that project. Also, we want to touch base. The Small Business Association, SBA, has a restaurant revitalization fund that opened yesterday. There's roughly $28.6 billion available in support of specific businesses, restaurants, food stands, food truck carts, caterers, bars, saloon lounges, bakeries, brew pubs, tap rooms, microbrews, and licensed facilities that serve alcohol. There's a process that's available there for that funding. It's a first come, first serve. So again, that information is located on our webpage for businesses that would like to find more information on that. The West Central Small Business Development Center also is willing to help businesses provide or help them through that process of applying if they feel they need some of that help. During the board today, we did receive a notification there's a drug court graduation virtually tomorrow, May 5th, and so you should all have that link. After board last week, we did hear from the Department of Homeland Security that the Real ID process has been extended from the deadline from October 1st of this year through May 3rd of 2023. And so we're hopeful that will have an impact on the wait times, certainly at at our DMV along with the additional staff members. And so that was new. And then lastly, we would just like to recognize this week is Tim Dent's last week, our technology director. He's provided service to Clay County and to our departments for the last 31 years. And so we appreciate all the years of service that he's provided. We are going to be having a socially distanced open house here in this space on Friday from 2 to 4 p.m. for those that are interested. So that concludes my report.
I noticed, I was gonna bring this up earlier, forgot, on our bills today, there was a membership dues for Moorhead Business Association. I think it was $500, I think that we paid. And I keep getting emails from them also, that they have their meetings. Does anybody go to those meetings, or?
Yes. Yep.
Okay, we got, so that's someone's assignment to go on there, or do you?
We're all considered alternates, but if there was a voting issue where a voting member would be on there, I think I listed as the voting member.
Okay.
But I don't know that they've ever done a vote amongst the membership that informed them.
Well, they have, I think they have weekly meetings, don't they, or?
Every Wednesday.
Okay. All right.
And I think the fact that we're all alternates on there, I think, I think if you, and they've been doing some of the social distancing, or virtual, and in person. I think the fact that we're more than two of us would be there, I just have to be cautious that there's, coordinating, so.
Thank you.